Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition sinusitis. Sinusitis is an acute or chronic inflammation of the paranasal sinuses. Okay, paranasal sinuses. The sinuses are air-filled continuations of the nasal passages lined with mucous membranes. Okay, with acute sinusitis, inflammation of the sinus, there is inflammation and swelling of the sinus mucosa. Okay, the sinus openings become blocked. A mucopurulent discharge is produced with fills at the affected sinus. Okay, so chronic sinusitis, chronic inflammation of the sinus, occurs as a result of persistent or recurrent infection. The mucosal, pertaining to mucous lining, the mucosal lining thickens and may form into elongated masses called polyps. There you go. In rare cases, due to proximity of the meninges, okay, complications of sinusitis may occur, such as meningitis or brain abscess. Okay, so inflammation of the meninges, it's in the brain, or abscess in the brain. Okay, there are types of paranasal sinuses. One is the frontal sinuses, which appears on x-rays by 7 years of age. Okay, they drain into ducts that empty into the top of the nasal cavity, pertaining to the nose, nasal cavity. Okay, now there's the ethmoid sinuses, which are the variable number of small cells that empty into the lateral portion of the nasal cavity, the cavity in the nose. Okay, these sinuses appear between 2 and 8 years of age. All right, guys. So this is the age of when the ethmoid sinuses appear on a person. All right. So these sphenoid sinuses. Hang on. So for this sphenoid sinuses, the two sinuses in the sphenoid bone. So these are the two sinuses in the sphenoid bone. Are relatively large, making the walls of the sphenoid bone itself thin. Okay, they drain into posterior portions of the nasal cavity, so the cavity in the nose. These sinuses appear after 2 years of age. There you go, guys. Okay, so we have the maxillary sinus, the largest sinuses, which are present at birth and continue growing up to 25 years of age when all the permanent teeth have erupted. Okay, this sinus drains superiorly to the nasal cavity, drains superior at the top of the nasal cavity. If the head is held upright, it is impossible for the sinus to drain until it is full. Okay, the head must be horizontal to completely drain the maxillary sinus. All right, guys. Causes. The causes of sinuses. So there is viral infection from a cold virus. There is a dairy and wheat products. Bacterial. Next is bacterial infection from the extraction of upper molars or a molar root abscess. Okay, an increase in pressure, such as during an airplane flight or underwater diving. Here you go, guys, which causes the forcibly entry of infected material into the sinuses. Okay, so these are the causes. Now, predisposing factors, so deviation of the nasal septum. Okay, septum is like a division, okay, which obstructs the sinus outlets, right? Dairy and wheat products, which may predispose to an overproduction of mucus in people who have sensitivities to the foods, right? And an upper molar abscess, which may spread infection to the maxillary sinus, pertaining to the maxilla sinus. Okay, now for the medical treatment, It is treated with analgesics and decongestants. So these are the medication to treat sinuses. Right? Prolonged use or overuse of medication, including over-the-counter remedies, can lead to worsening of the symptoms. Okay, so prolonged use of medication can damage the tissues, and the mucosa may respond to over-medication by producing more mucus in a rebound effect. In chronic cases, surgery may be performed. Okay, chronic, it's been there for a long time. An additional opening may be made to drain the sinus. The mucus lining may be removed, or the deviated septum may be connected to open the passage. Symptoms of sinusitis. So there's pain for acute sinusitis, often severe, and tenderness over the affected sinus. Okay, other information, just read on this, guys. Now, there's difficulty breathing. Okay, there's a feeling of fullness and pressure in the affected sinus, and the person has difficulty breathing through the nose. Okay, other information, just continue reading, guys. Okay, so with chronic sinusitis, the pain is dull. Okay, the pain is dull. And the discharge may stop entirely at the sinuses. Various sinuses remain blocked. Okay, so let's move on to part 2, the subjective component. Now we have health history questions here. Just read on this, guys. Just read on these questions. Next is the part 3, which is the objective component. We're going to be doing the assessment. So for the assessment, we're going to do observation. So the therapist should observe the following symptoms. The symptom of facial pain or pressure, stuff of nose, runny nose, cough or congestion, fever, bad breath, fatigue, dental pain. Okay, so just observe for these symptoms, guys. Now for the palpation during the assessment, so you're gonna do palpation of the frontal sinuses. It's made by the therapist, gently pressing superiorly at the medial angle of the superior orbital margin. Okay, the maxillary sinuses are palpated under the zygomatic arch. Tenderness, which is like pain, and heat are present on the area. The lymphatic nodes in the neck may be enlarged. Okay, these are, you're gonna be feeling this when you do palpation. For testing, so the special test you're gonna do is transillumination of the sinuses that may reveal blockage. Okay, this is the test for sinusitis. Okay, contraindications. Massage is contraindicated with fever. So if the client has fever, then massage is contraindicated. Okay, local lymphatic drainage is contraindicated with acute infection. So that is contraindicated as well. Local, like on the site, the area where there is you can see some, you can feel or palpate some symptoms, then local lymphatic drainage massage is contraindicated if there is acute infection, sudden infection. Okay, so let's move on to part 5, which is the treatment plan. We have goals here to follow for the treatment plan, so you just have to read on this, guys. Now for positioning, pillowing, and draping, maybe on prone position, okay, or sideline position, or supine position. Just read on the information, guys. For the techniques, we have a few here. Just read on the information, guys. Now let's move on to part 6, which is the self-care plan. We have goals here as well. Just read on the information, guys. Okay, let's proceed to the treatment frequency. So the treatment is a half hour in duration to avoid over or to avoid exhausting the client. It's just half an hour. All right. So for the expected outcomes, the client is referred to a physician or dentist for assessment. Okay. If the infection worsens or does not resolve, a naturopath can help with strengthening the immune system and reducing the infection. Okay, so that will be your expected outcome. So you're gonna have to refer the client to the physician or dentist for assessment if the maxillary area, the have the teeth and gum problems in the maxilla area, and if there is a presence of infection, then it is really good to refer the client to his or her family physician and the dentist as well for additional assessment to help the client. And if to strengthen the immune system, then you have to refer the client to a naturopath. Okay, the naturopath can help with diet and other medical stuff to help the client strengthen his or her immune system. Okay, now this ends our video for the treatment plan for sinusitis. Thank you all guys for watching. Please subscribe, like, comment, and share this video. And again, thank you and have a great day.